Hello everyone, I'm Dr. Fatima Zahra from Imara Healthcare. I'm a GP here with 4 years experience. I'm here to talk about respiratory tract infection, which we encounter every day. Our lungs go through tremendous pressure every day to keep us alive. So mostly we get from the environment that we inhaled, and another way it's getting affected by the infections that's around us. So first, let's talk about the infections that we are really encountering every day. Mostly it's upper respiratory tract infections and sometimes accompanied with the lower respiratory tract infections. For the respiratory infections, firstly we will start we will be having fever, body pain, fatigue, running nose, nasal congestion, throat pain, voice hoarseness. And for sometimes with the lower respiratory tract infections, we will be getting cough with or without sputum, sometimes shortness of breath, and sometimes this cough will be tremendous, especially in the night. If for this illness, you can start with the home remedies, like you can take warm meals, you can take inhaler, you can take steaming. And along with that, sometimes you can just take the over-the-counter medications like paracetamol, antihistamine like cetirizine, fexofenadine, and some cough syrup. But if you feel the symptom has gone out of your hands and you're feeling fatigue and fever much with the paracetamol, you should immediately come to see a practitioner. There are some misconceptions that we go through, and we've been asked by the patients. Like when a patient visits us directly, they will be asking, can I take antibiotic? So I would really recommend that antibiotic is not the first line that we should be looking at. And people think that without the antibiotics, they will not be cured. So this is a very wrong misconception. The respiratory tract infection can be viral or bacterial. So for the viral infections, no need of antibiotic. The bacterial infections can be helped with the antibiotic. So at that moment, the practitioner can decide for you which will be best for you after the diagnosis and the test. Often after prescribing antibiotics, the patients stop the antibiotics in between. They feel like it's been 2-3 days and they're feeling better, they stop the medications. So they come back in 1 or 2 months feeling the same respiratory tract infections and fatigue. So whenever you're asking them, and they'll be like, Madam, I felt like 2 days, 3 days, I felt better and I stopped the medication. So if a medicine has been prescribed to you, I kindly request, please finish the dose. If you have any doubt, you definitely reach out to your practitioner. So when you've encountered symptoms like fever, flu or cough, you take the over-the-counter medications and home remedies. But if the symptoms is elevating and escalating, you should immediately come for treatment. So in Imara, we are here to help you. Good health in good hands. Thank you for watching.